Hello, we're going to talk about phlebotomy and blood culture drawing process. This is part of the education on IV skills. So just a couple of tips about phlebotomy, and then we'll talk about our blood culture process. I think there's more involved in the blood culture part of it, so we'll leave that for last. A lot of the things we talk about here are things that some people might do a little bit different. There's room for people having their own way of doing some things, but there's others that there's no room on, and I'll try to kind of go over some of those. So first of all, these are our most common lab tubes, and a lot of times I hear people say, "Oh, I drew a CBC, but it was hemolyzed," or "I drew a chemistry and it clotted." Right. So just to kind of go over this again, when you draw your blood, you always want to, let's say you're drawing like a full rainbow on somebody who you're drawing 10 mLs on a bigger kid, or even at smaller kids with bullets. You always want to do the blue one first. The blue one has to do a lot with clotting, so you want to get this one as soon as you draw it. The last one you want to do is the green or the yellow, because these have a clotting factor inside of them. So if you were to poke these first and some of that clotting factor got in your syringe and then you put it in the blue, you might get some clotting in the blue. And so these tubes right here, these three right here, are collected to analyze serum. This one is collected to analyze blood cells. To be able to analyze serum, the blood has to clot. So if somebody says, "I couldn't run the green top because it was clotted," that doesn't make sense, because the green top, the yellow top, and the red top are supposed to clot. These are the ones that they're gonna spin down in the machine down there, and they're gonna extract all the blood cells, and they're gonna test the serum. This is why when you send the chemistry, if there's hemolysis, and I'll explain a little more about that in a minute, you're gonna get skewed numbers because you're measuring what's outside of the cells. So hemolysis, like everybody should know, is the breakdown of cells. In this case, the breakdown of red blood cells specifically. And so when you're measuring serum, and let's say you're going to measure the potassium, the level of potassium inside a cell is a lot higher than the level of potassium outside of the cell. So when your cells break up and that potassium spills into the serum, it doesn't give you an accurate number of the patient's potassium level. That's why you can't hemolyze the blood. When you spin down these tops and you see the serum that's left over, it should be like a clear yellow. When it looks pink, then they know that there's some hemolysis in there. And so depending on the grade of pink is how they say it has a grade 1, grade 2 hemolysis. And if it's more than just a little hemolysis, they'll throw the sample away because it's no good. How do you avoid hemolysis? So remember, it's breakdown of cells. Hemolysis is completely avoidable, and it's only caused by the drawing process. So if you are constantly having labs that are hemolyzed, there's something that you're doing when you draw your blood that you need to change. The number one reason why blood gets hemolyzed is because when you draw in a syringe, you create suction inside the syringe, and you're exploding those cells with the suction that you create in a syringe. So you should never draw back blood and create suction. When I mean suction, is like that little air pocket gets really big. If you do that, throw the sample away, start drawing again. You've hemolyzed your blood. So when you draw, you should be using the right size syringe, and the smaller the syringe, the less chance of hemolysis, because you can control the blood flow into the syringe better. If you have a big syringe, like a 10 ml syringe, even if you try to go slow, you may create some suction in there and hemolyze that blood. With a 3 or a 5 ml syringe, there's less of a chance of that. I would not draw blood from any line on a child with anything bigger than a 5, and that's if they have at least a really good vein on a 22 gauge or a 20. If they have a 24 gauge, you should never try anything bigger than a 3 ml syringe. And if you cannot get the blood by very, very softly pulling on it, just don't get it. Poke the kid again, because that blood is not going to be any good. Anyway, talked enough about hemolysis. That's one of the big reasons why blood gets sent back. And then the other one is clotting. So when you're drawing a CBC, it cannot clot, because now those clots take up a lot of the red blood cells, and when you do the count on the free flowing blood, it's going to be off. So you're going to have, if you do if they don't kick back a clotted sample, you're going to have a CBC that's really low H&H, even though it might be normal, but because there's clots in there, it's keeping all those red blood cells in a clot and not measuring it. So this one cannot clot. So if you ever are drawing blood, and when you go to put it in here, it's just like little clots of blood, just throw it out, draw it again. This one has to be free flowing for it to be good. All right, different things that we're gonna use. This little transfer device here can be used in a couple of different ways. You can have your blood and you can hook it up here and poke the tubes if you want to, or on most kids that I would say less than 6 or 8 years old, if you're gonna stick them with a butterfly needle like this one, a smaller one, you should not be using the vacutainer directly to the tubes. So if I were to hook this right here with this setup, I'm gonna collapse that vein and you're not gonna be able to get any blood. So what you should do is open this little piece up and take off this part right here and hook up your syringe directly to this hub. And now you can control the flow of blood out of that vein instead of hooking up the suction right here. I hope that makes sense. Now, if it's a bigger vein and you're using a bigger butterfly, you can hook it up directly to that connector. And actually, you wouldn't be using this one. You would be using these right here, right? That don't have anything on there. So these just go right over this little thing, like that. And now you have basically the same as that, okay? And I'll make sure that we have these on the floor because I'm not sure if we do right now. So these are really good for bigger kids or kids with like really good veins to draw anything, but also to draw blood cultures, okay? Because this little top goes right in here and you can get all your blood culture blood right from there. Now, do we have anything else that you can think of, Kristen, on the phlebotomy part of it? I think that's enough tips. Make sure that when you put on your tourniquet, that you don't leave it on for too long, and that specifically you don't leave it on after you're done drawing the blood, because that has happened. So remember always to pop off your tourniquet. You should always have your tourniquet on when you're drawing blood. If you have an extended draw, like you don't want to give up, you want to keep trying, have somebody pop that tourniquet off, wait a couple of seconds, put it back on, especially if you're drawing coags, because that can affect the coag time. I think that's enough of that. Now, let's talk about blood cultures. We're gonna talk only about the pediatric, smaller kids blood culture process here. I have a separate video on what we should be using on older kids and in adults. And in ICU, the ICU charges us to draw their own blood cultures, and we make these pre-made blood culture kits. We're gonna make these also for peds, but we're gonna make them with peds bottles instead of the adult bottles. And we talked to the infectious disease folks and the Moores and about this before making this video. And what their consensus is that if you're going to be drawing blood cultures on a child, what they really want is at least one really good, accurate blood culture. The evidence and everything shows that you should always draw 2 sets of blood cultures. But if you're having to poke a kid 5 times, if you don't think you got a good sample, if you're having to poke a kid multiple times in the same site, it's gonna contaminate that sample. And you don't ever want contamination because it defeats the purpose of doing the blood culture. So what they want is they want at least one really good blood culture with at least 1 ml of blood for the pink blood culture tubes. At least 1 good ml of blood. So if you've gotten that, and what they recommend is anybody less than 6 to 8 years old should be having these. Anybody above 6 to 8 years old that has better access, you should absolutely always draw 2 sets of blood culture. When I say a set, this is 1 set, okay? And on the bigger kids, this is one set. These tubes need a minimum of 5 mLs, 7 to 8 mLs is better each. So you're looking at a 10 ml draw minimum for these. This is a more accurate blood culture than the pink one. And it gives you aerobic and anaerobic, and it's just easier to identify the organism, but it needs more blood. So this is why we don't use it in pediatrics as much. I do want you to watch the video that we're gonna give you the QR code for this blood culture draw process. It's a little bit different than the one that we're gonna talk about here, but I want you to learn that because we're gonna have older kids, and some doctors that say, I want 2 straight up regular blood culture sets, and so that sometimes you're gonna have to do these. All right, the number one thing about blood cultures is, if you remember when we went to school, and we took micro and we grew all the bacteria in the petri dishes, it takes literally just 1 bacteria to multiply and to cause contamination. So a blood culture drawing is a sterile process, but it's done not in a sterile field. So you have to be really careful with what you're touching and with where you're putting all your equipment. I would never do a blood culture and put all my equipment on top of the bed. I want it on top of a table, because if it's on the bed, it falls over and it touches something there, you're contaminated, you're done. And we want a 0% contamination rate. So again, for the adult ones and for these big sets, we're gonna post a video, I want you to watch that. And we are gonna make these kits for peds, and inside the kit is gonna be this little paper right here that will have all the equipment that you need and the steps to drawing your blood culture. All right, so it'll be right here on paper. So for pediatric blood cultures, anybody younger than 2 months old cannot have chlorhexidine. They have to have iodine. What I always like to do is, when I'm prepping the site, I make sure that everything else is ready, so that after I prep the site, I don't have to be getting more stuff, right? With iodine, you're gonna scrub back and forth for 25 seconds. Some people say 30 is fine. 25 seconds is what our policy shows. That's what best practice, but if you want to do 30, that's fine. But the most important thing about cleaning your site is not how long you're scrubbing it. It's how long you let it dry. Because this and chlorhexidine, they both work by desiccating and hemolyzing the bacteria cells. So that doesn't happen until it dries. If you're poking chlorhexidine when it's wet, you're literally poking through live bacteria. You have to let it dry. Iodine, same way. If you're poking through wet iodine, it's not doing anything. So you're gonna scrub back and forth the area. Don't do a gigantic big circle. Just do, like, I would say, maybe an inch or two around, up and down. Vigorously rub for 25 seconds, count it out. Don't spit on the patient while you're counting, right? Wear your mask, or, just count in your head. Anybody older than 2 is gonna use these little swabs. They can also use these. This is the same. These are both chlorhexidine. These are going to be stocked sometime next week. In peds, I don't think we have them yet, peds and PICU. These we have right now. You can use both of you. Notice how big that is. That's a lot for a 3-month-old. So we're gonna have these swabs. This is what we do use on adults. You don't need anything bigger than this. You do not need sterile gloves to do blood cultures, but you cannot touch the site. You cannot palpate the site after you have cleaned it. Absolutely never can do that. If you touch the site, you have to start all over. So don't just wipe it off again. You have to start all over because it's gonna get contaminated. There are tips and tricks on how to identify your vein before you go to poke it, and I think I might have shown that on the last video, but it's definitely on the adult blood culture video, so I'm not going to go over that right now because you guys are going to watch that one too. So you're going to put your tourniquet on, you're going to identify your vein, you're going to scrub vigorously for 25 seconds, and then you're going to pick your needle. Now again, for the pediatric blood cultures, if you're just drawing 1 ml, what we recommend is that you sterilely, right, without this touching anything else, hook up your syringe right there. Make sure that this syringe didn't touch anything, because if it was out of the package, it's done. And then you're gonna scrub and, obviously poke the kid, draw your blood, and then after you've drawn your blood and you remove this needle, don't aspirate the last bit of blood, because that's gone back to the skin and you might get a contaminant in there. So just take this off and use your transfer device and put it in your blood culture bottle. Also, before I even start, always grab a little bit of alcohol and I just kind of swab it and leave the pad right on top until I'm ready to transfer that blood in there. Same thing with the other ones. You want to make sure you clean that. And 1 ml is enough for here. I wouldn't worry about getting any more than that. 1 ml is plenty. And if they do order 2 sets on a kid, they have to be done in 2 separate sites, and they have to be done 15 minutes apart. Mobilab will not allow you to, it will look like you're doing the same blood culture twice if you do it within the same span. So if you're doing 2 blood cultures and you go to print your Mobilab labels, you have to print the first one when you collect your first culture, and then print the second one at a different time when you collect your second culture. You can't print all your labels first because it'll look like you collected all 4 at the same time. Don't ever feel like you have to get the 2 sets to the point that you just draw blood from one place and you just fill all 4 bottles. That is not helping anyone. If you have to do 2 sets and you couldn't get enough blood, just do 1 set. Cancel the second set. But again, some kids, we really need to be getting that second set because it really helps with lowering your length of stay on kids that have a contaminant that are now having to be treated for 5 days with antibiotics when it was just a contaminant. That's what that second set does. It helps us avoid the length of stay, the cost, trouble for the patient and all that. So I think that's, pretty clear. Some people, this is some of the things we've noticed, some people have gone in to draw blood cultures with just some alcohol pads. Absolutely no. You have to use chlorhexidine or betadine. Like I said, have everything ready. Don't put anything on the bed. And you cannot draw blood cultures when you're starting an IV. And I know that's a kind of a big deal, especially on these little babies. But when you start an IV, the IV catheter, the plastic piece, as it's going into the skin, grabs a bunch of skin cells and it can grab bacteria. So the contamination rate when you use blood from an IV start, average is 7% if you do everything right. If you use a needle, it's less than 3%. So it's a big difference when you're starting an IV. You should not be drawing blood cultures when you start an IV. I know it's done every day. I know it's done in the ER. And there may be a circumstance where I might say, you know what, this kid's been poked 20 times and I have to get an IV and I have to get a blood culture, and that's okay. But don't make it your practice to do that because it does raise your contamination rate. So hopefully those tips will help you with phlebotomy. If you have any questions, let us know so we can maybe add to this education, because this is gonna go to people moving forward. And that's it. Thank you.